Good afternoon, everyone. I'm Kim Collins-Lee, Acting Director of the National Eye Health Education Program, also known as NEHEP, of the National Eye Institute at the National Institutes of Health. Thank you for participating in today's webinar, D-Glaucoma, Insights for Community Leaders. We will begin with introductions of our speakers for today and the learning objectives for the webinar. We will then move on to presentations on the fundamentals of glaucoma, NEHEP and the Glaucoma Education Program, Keep Vision in Your Future Glaucoma Toolkit, glaucoma and community engagement. We will end with questions from the audience. Presenting with me today is Dr. Julia Rosedal, a practicing glaucoma specialist, clinician scientist, and assistant professor at the Duke Eye Center at Duke University. She also serves as the glaucoma expert on the NEHEP Planning Committee and has published numerous articles on glaucoma and vision loss. Dr. Cheryl Reynolds is an associate professor at Nova Southeastern University College of Optometry. She is currently vice president of the National Optometric Association and a fellow in the American Academy of Optometry and the Optometric Retina Society. She chairs several subcommittees and has authored numerous articles on ocular and systemic diseases. Also, Shelley Heath-Watson, who is the program director at ICF and provides support to NEHEP, will be discussing NEHEP's new English glaucoma toolkit. After this presentation, you will be able to explain the basis of glaucoma and its risk factors, prevention and treatment options for glaucoma, available resources for community outreach, and strategies to build glaucoma awareness at the community level. Now I'd like to turn over to Dr. Rosedal, who will present on the fundamentals of glaucoma and the need for awareness. She will begin with a personal story of a patient, and then she will discuss the fundamentals of glaucoma, including diagnosis and treatment.
Thank you. I'd like to start off with a story about one of my patients. He's actually unusual for me in that he wasn't sent to me by another doctor specifically for glaucoma. He came in to see me because he had a bump on his eyelid that he wanted to have checked. He'd been to the urgent care but wanted to be checked by an ophthalmologist. He was 64 years old, and he's African American. He was otherwise pretty healthy but hadn't had an eye exam in a while, and glaucoma really wasn't on his radar at all. His vision was normal, and his exam was significant for the bump on his eyelid, which was just a resolving stye at that point, but his eye pressure was elevated. His pressure in the right eye was 28, and he'd lost some vision peripherally when we did automated visual field testing. And even though his pressure was high in the left eye too, his visual field was still normal. So what a shock to this gentleman and to his wife that he had glaucoma, because he had absolutely no symptoms. And even though he had several risk factors, African American race, older age, he didn't even know that he was at risk for this blinding disease. Currently, he's doing wonderfully on treatment, and every time I see him, we talk about how lucky we are that that stye led to his glaucoma being diagnosed and treated. Glaucoma is scary because it causes irreversible vision loss, and vision loss is frightening to Americans. This poll from several years ago shows that Americans are more scared of losing vision than of most other diseases, including cancer and stroke. Vision loss is linked with worse quality of life, decreased mobility, more injuries, depression, and increased risk of dying. Glaucoma is common. It's the second leading cause of blindness in the United States. Currently, there are almost 3 million Americans with glaucoma, and that number is on the rise with our aging population and set to double by 2050. The worrisome corollary, though, is that half of people who have glaucoma, who are losing peripheral vision, they don't know it. They don't know they have glaucoma, and they're not getting treatment. The most common type of glaucoma in the United States is primary open-angle glaucoma. This short video that I'm going to show you in a moment shows how the eye can develop glaucoma. You'll see that the eye pressure is regulated at the front of the eye, where the aqueous fluid is made in the eye and then drained back in the blood. And you'll see where the damage happens in glaucoma at the back of the eye, at the head of the optic nerve, if the eye pressure is not regulated properly. So here's the video.
A clear fluid flows through the anterior segment at the front of the eye, nourishing tissues. At the open angle where the cornea and iris meet, the fluid flows through a spongy meshwork and leaves the eye. But if it passes through too slowly, pressure inside the eye rises to a level that damages the optic nerve, resulting in vision loss due to open-angle glaucoma. Untreated, the vision loss progresses from normal vision and no pain to gradual loss of peripheral or side vision and eventually total vision loss.
A key point about eye pressure before we go to the next slide, because high eye pressure is really important for glaucoma. It does put you at risk for glaucoma, but not everybody with glaucoma will have high eye pressure. So measuring eye pressure alone really isn't enough to diagnose glaucoma. There are multiple risk factors that are important. And that takes us to our first poll question. So I'd really like it if everyone out there could choose answers that they think are risk factors for glaucoma. So we see everyone's answers here. A lot of people noting African American race, family history, older age. Those are really important. But actually, all of those are risk factors for glaucoma. So really anyone can get glaucoma. It can happen in babies and children, although that's very rare. It's much more common in adults. And people that are at higher risk for glaucoma include African Americans and Hispanic Americans, older people of all races and ethnicities, and people with a family history of glaucoma. And these are the populations that NEHEP works with its partners to reach. There are a few more risk factors that can surprise some people. Glaucoma is associated with other common diseases like diabetes and high blood pressure. And another way that you can help your patients is by educating them about their risk of glaucoma if they've had an eye injury in the past. Because even a relatively mild eye trauma that didn't need surgery or treatment could damage the delicate drainage tissue in the eye and set you up for glaucoma in the future. And it could happen within days to weeks after the trauma, or all the way to years or decades later. So lifetime surveillance after eye trauma is really crucial. The way that we detect glaucoma is through a dilated eye exam. So it's really a dilated eye exam that's needed to diagnose glaucoma. A glasses check, an eye pressure check, they're really not enough because some people with glaucoma won't have elevated eye pressure, but they'll still be losing vision from it. We don't currently have a cure for glaucoma, but there are many excellent treatments. All are aimed at lowering eye pressure, even if it's not too high. It's too high for that person's nerve, and so we lower it. Most people who are treated for glaucoma do not go blind. Most commonly, eye drops and lasers are used to treat glaucoma patients, and surgery is usually reserved for cases that can't be controlled medically. A common question that I get from patients is about diet and glaucoma. There really isn't a vitamin or a diet that's been proven to treat glaucoma. I do usually recommend a heart-healthy diet and a good multivitamin because those are good for overall eye health, even though they don't directly address glaucoma. There are new treatments coming as well for glaucoma, both a couple of new classes of eye drop medications that should be coming out soon, as well as new, safer glaucoma surgeries that look like they're most useful for patients with less advanced disease. We have our next poll question for the audience. I'll give you a moment to read it and choose your answer. It's a true-false question. Now I see, wow, well, you guys are a good audience. You already know a lot about glaucoma. So the correct answer is false. People with glaucoma do not usually have changes to their central vision until late in the disease. And that's really why awareness is so important about glaucoma, because it's known as the silent thief of sight. Really no early warning signs, and the blindness from glaucoma is irreversible. So early detection, which is made possible by the awareness work of people like all of you in the audience, and diagnosis with a complete dilated eye exam, those are the things that can save sight. There are still huge gaps in both awareness about glaucoma and knowledge about glaucoma. There is a study done in patients who are sitting in an ophthalmology clinic, and in those eye patients, almost 3/4 of them had actually heard of glaucoma, but the rates of awareness were lower in African Americans and Hispanic eye patients, and those are the folks that are particularly at risk for glaucoma. And even when people had heard of glaucoma, knowledge about the disease was strikingly poor. For example, 3/4 thought that glaucoma would have symptoms when it was getting worse, and 2/3 thought that central vision was affected first. That's why NEHEP and the work that all of you are doing is so important, because as a glaucoma specialist, we can't offer those proven treatments to patients that don't come to us and don't know that they have glaucoma. In the next portions of this webinar, you'll see how NEHEP is developing resources for increasing awareness about glaucoma, and you'll hear from Dr. Reynolds and see the amazing work she's doing, bridging this knowledge gap about glaucoma and helping prevent blindness from this important but poorly understood disease.
Thank you, Dr. Rosedal. Now I'm going to discuss the NEHEP and our glaucoma education program. NEHEP is committed in making vision a public health priority by translating eye and vision research into public and professional education programs. NEHEP supports collaboration among eye health professionals, healthcare providers, and intermediary organizations. The current program areas under NEHEP include diabetic eye disease, glaucoma, low vision, ojo con su visión, or watch out for your vision, vision and aging, and Right the Vision, Make Your Plan to Protect Your Sight, our soon-to-be newest program that is currently being pilot tested. The NEHEP Glaucoma Education Program is designed to help you raise awareness about glaucoma among the people you serve. Our educational resources are designed to communicate the following messages to help prevent vision loss in people at higher risk. Glaucoma often has no early symptoms. People at higher risk need a comprehensive dilated eye examination every 1 to 2 years. Early detection, treatment, and follow-up care are key to preventing vision loss and blindness. Shelley will now present the role of community outreach in glaucoma awareness and the newly improved glaucoma toolkit.
Thank you, Kim, and thanks to all of you who have joined the call today. We're very excited to have you. As community leaders, health and community professionals, and educators, you play several important roles in the communities that you serve, and one of those roles is as a trusted source of information. As such, it uniquely positions you to share eye health education messages, increase awareness about glaucoma, and even encourage the members of the communities you serve to take action as it relates to glaucoma. And that action could very well help save their sight. Now, the National Eye Health Education Program, or NEHEP, supports the various outreach efforts that you do in the community by offering free downloadable resources. NEHEP has fact sheets, brochures, social media content such as posts, tweets, info cards, and infographics, and presentation toolkits. And there's one toolkit in particular that I think you'll be interested to learn about, and that's Keep Vision in Your Future, Glaucoma Toolkit. It was originally developed almost 10 years ago and has undergone a significant refresh, and that includes the content as well as the graphic presentation. I'm sure you'll find that the format supports the use by the novice and the experienced presenter, as well as someone who has glaucoma background and someone with little or no glaucoma knowledge. The information was assessed by a group of experts and was tested with the key audience segment, and it provides a great background for you to do your community outreach. So what's in the toolkit? That's a good question, and I'm glad you asked. There's some great things in the toolkit. We've got an animated PowerPoint presentation. We've got a speaker's guide that contains very detailed speaker's notes and directions. And as I shared, you do not have to be a professional speaker in order to use the toolkit. There's several handouts. Many of them are customizable. There's a glaucoma IQ test and also a promotional event announcement that you can customize, including your organization's name and logo. The toolkits are available in both English and Spanish, and you'll see the information in terms of where you can locate it online. I now have the honor of turning the slides over to Dr. Reynolds. As you heard, she is a member of the National Optometric Association, and she will share with you some of the great work that her organization is doing in communities around the country. Dr. Reynolds?
Thank you, Shelley. Let me begin by introducing the National Optometric Association, the NOA, which was founded in 1969 and is dedicated to improving the quality and accessibility of eye care in minority and underserved communities. We are comprised primarily of minority optometrists throughout the United States, and I'm proud to currently serve as Vice President for this organization. Our mission of advancing the visual health of minority populations is a shared priority with NEHAP. We, too, are committed to reducing visual impairment and blindness from eye diseases like glaucoma among populations at higher risk, our African American Black population and our Hispanic Latino population. And as previously mentioned by our glaucoma specialist, Dr. Rosendahl, awareness and knowledge of sight-threatening conditions like glaucoma is the lowest amongst the patients at higher risk, the very population the NOA is focused on. So, we conduct numerous awareness campaigns and community outreach events throughout the year. Also, in an effort to address our diverse patient population, the NOA is actively involved in helping to recruit minority students into our schools and colleges of optometry, providing mentorship and guidance, scholarship, and assistance in job placement after graduation. And we also work with and support our student organization, the National Optometric Student Association, or NOSA, in increasing eye care and awareness in minority communities near schools and colleges of optometry as well. As we discuss strategies to build awareness about glaucoma, I would like to share with you, the audience, what the NOA has done. Our 3 Silent Killer initiative, which focuses on the top diseases causing blindness among racial and ethnic minorities, specifically our African American and Hispanic communities, is one of our most successful programs. These diseases include glaucoma, diabetic eye disease, and high blood pressure. It was branded the 3 Silent Killers to not only stress that they can lose their vision and go blind from these conditions, but to emphasize the negative impact these diseases have on their quality of life, with disability and depression, as Dr. Rosendahl mentioned, and most importantly, that these diseases can kill, and kill them early. Our 3 Silent Killer brochures are available in Spanish and English and emphasizes the importance of prevention with timely and routine eye care before it's too late. We also conduct 3 Silent Killer focused community outreach events, particularly during key awareness month, like January, which is Glaucoma Awareness Month. We perform vision screening, distribute our 3 Silent Killer and NEHAP educational material, and we also hold talks about glaucoma at these events. Our partnership with NEHAP has really been effective in helping to build awareness about glaucoma. And we recently partnered on their newest pilot program, Write the Vision, Make Your Plan to Protect Your Sight, which is designed to inform African Americans about eye diseases and encourage them to take action to maintain healthy vision. Our partnership includes monthly communication with personalized messages as seen in the image on the right of Celebrate Your Life, Protect Your Sight, which are focused on glaucoma, diabetic eye disease, low vision, vision and aging, and ways to maintain healthy vision. These personalized messages may better resonate with our target audiences and are shared with our NOA doctors, who are encouraged to share them with their patient base and to provide feedback. I personally believe that this is a great way to capture both the doctors' and patients' attention in getting the message out about these diseases. And I look forward for having this as an established NEHAP program for all of you to have for your community outreach efforts as well. We've also found NEHAP Glaucoma Toolkit to be an effective tool during our community outreach events, especially in educating our small groups about this disease. And we recently participated in revising the Glaucoma Toolkit. In helping NEHAP to revise the Glaucoma Toolkit, the NOA participated by providing expert assessment of the content, recommendations on language, and additional causes of glaucoma as well as prevention options. And we tested the toolkit at our community outreach event held in an urban area in Chicago during our annual convention last year, with multiple groups of African American participants who were about 40 to 65 years of age. They were given the glaucoma IQ pre-test to assess their knowledge and awareness about the disease, the PowerPoint presentation, and then handouts about glaucoma. We were able to engage the participants, answer their questions and concerns about glaucoma, and their feedback provided valuable information for improving the toolkit. The NOA's recommendation for improvement to the toolkit includes that the toolkit have more images of population at higher risk for glaucoma. Those are your African American, Blacks, and Hispanic individuals, to better resonate with the presentation audiences. We also recommended having images of younger African Americans, Black individuals, those in their 40s, to really emphasize that glaucoma starts early in that population. In addition to more images, the language in the revised toolkit was also made easier for the participants and the speakers to understand, which addresses some of the issue of literacy, which can be a barrier to increasing awareness about glaucoma in some communities, your low-income and your urban communities. It also addresses frequently asked questions from the participants, like, should I worry about glaucoma if my brother has it or had it? Which really highlights the need to address again that family history of the disease is an important risk factor. The revised toolkit includes more information and stresses the importance of family discussion about glaucoma. There were also questions about vision and glaucoma, such as, can I have 20/20 vision and still have glaucoma? In the image to the right, the revision to the toolkit not only includes the answer yes, but stresses that the disease affects side vision first, because, as mentioned by our glaucoma specialist, Dr. Rosedahl, a majority incorrectly believe that it affects their central vision first. It also stresses that people with severe and advanced glaucoma can have 20/20 before it causes irreversible blindness, which underscores that this disease is the silent thief of sight. Others wanted to know the purpose of their medications, with questions like, how does my glaucoma medication work? This is an important question because lack of understanding can lead to poor compliance and adherence to treatment. The purpose of the drops, lowering eye pressure, and other treatments, laser and surgery for glaucoma, are thoroughly discussed in the revised toolkit. And I just want to take a moment to mention that we all play an important role, including you in the audience that are community leaders, in reinforcing the message of the importance of patients who are diagnosed with glaucoma to use their glaucoma medication and to follow up with their eye doctors regularly in the management of glaucoma. Also, if you have people in the audience or patients that you're dealing with that can't afford their medication, encourage them to talk to their eye doctors about assistance programs. Most companies have patients assistance programs to help them get their glaucoma medications. So we're going to talk about the NOA and our role in using the glaucoma toolkit and how it has been effective for us as an organization. It serves as a key component for us in our community outreach presentation. It provides NOA members with a guide for educating community members about glaucoma in a way that is easy for others to understand. It also provides NOA partners, churches, and community center leaders with a guide for educating members about glaucoma at future health outreach events as well. And it's used by our student chapter, NOSA, as seen in the image to the right of our College of Optometry in New York, utilizing the glaucoma toolkit in an education about glaucoma at a senior center. And it's also utilized at health fairs. So strategies that we have found successful in our community engagement also addresses some of the well-established barriers that have been identified and that many of you in the audience face in educating your people or patients about glaucoma. The NOA, again, our mission is advancing the visual health of minority population, focuses on higher risk and underserved communities, particularly the poor, low-income urban areas. We work in community partnership. As trust and communications have been identified as barriers, it's important to partner with local African American and Hispanic Latino churches in having small group discussions about glaucoma that encourages engagement and dialogue and maybe answer their questions and concerns about the disease. As cost of health care and lack of insurance are also barriers, partner with community health centers in underserved communities, many of whom don't have eye care, is important to reach in those communities as well. And working with health advisory groups focused on minority outreach can help you and your organization reach more people. For example, for us as the NOA, we collaborated with the National Dental Association at a recent outreach event, and more people came out for that event, allowing us to see more people, serve more people, and reach more people and educate more people about glaucoma. And to address transportation and other financial barriers that many in these communities encounter, the NOA has established a long-term partnership with Vision Service Plan, VSP Global, in having their mobile eye clinic van in these communities as well during some of our community outreach events. Our NOA doctors provide free, comprehensive dilated eye exam, education on eye health, including glaucoma, and VSP provides free glasses to those in need. So now we're going to have our third poll question. What activities has your organization conducted to help raise awareness about glaucoma? Good. Thank you so much for your feedback. I want to thank you for your answers. 29 people responded, and I saw some of the responses, and I appreciate your response. So basically, I want to end in summary by saying that what works for us, the NOA, can work for you and your organization as well. We encourage partnering with other community organizations or leaders that serve those at higher risk for glaucoma, like churches, senior centers, community health centers, and local health groups. Make yourselves or your organization visible at community events and health fairs. I want to encourage you, your organization, to provide on-site services if possible at events to encourage attendance. Partner with a mobile eye clinic. Recruit students. If your organization is near a school or college of optometry, reach out to them. Also, too, universities have pre-optometry and pre-med programs, so those students can help you spread the word about eye health and glaucoma. Identify opportunities to incorporate awareness into your organization, existing events or services. Capitalize on National Observance Month to increase your outreach effort. For example, January, which is Glaucoma Awareness Month. And finally, utilize resources that are easy to use and understand, like NEHAP's Glaucoma Toolkit in your community engagement. As an optometrist, I have to repeat what our glaucoma specialist, Dr. Rosedal, said earlier. We can't offer treatments to patients who don't come in for care or know they have glaucoma. And too many people are going blind from this disease. So I encourage you and your corporation to incorporate some of these initiatives and to partner with NEHAP so together we can combat blindness from this disease known as glaucoma. So I want to say thank you, and I will turn it now back over to Shelley, who will be taking some questions.
Thank you so much, Dr. Reynolds. A lot of great things happening out there. We're seeing folks doing some glaucoma outreach in senior centers, health fairs, some screenings, and even some conference presentations. And there were some that have not done any glaucoma outreach, so we're excited to have you on the line and hope you see great opportunities for you to participate in resources that you can use to integrate into the kinds of things you're doing into the community. So now we're going to open the floor to questions. You can use the chat box in the lower left corner of your computer screen to send us some questions, and we will answer them as time allows. Our first question is going to go to Kim Collins-Lee. The audience would like you to share again about some of the resources that are available through social media as it relates to glaucoma.
Okay, great question. NEHEP has a range of materials that have done very well on social media, and these include infographics, info cards, and animations. We also offer social media resources for each of our program areas, including glaucoma. You can find all of these resources on the NEHEP website.
Great. Thank you. We have a question for Dr. Rosedal. Dr. Rosedal, the audience member would like to know, are there other eye conditions that can put you at higher risk for glaucoma other than diabetes, diabetic retinopathy, and high blood pressure? What might other conditions be?
Well, that's a really good question. So actually we see higher rates of glaucoma in people who are nearsighted. Another name for that's myopia. And so people who have nearsightedness are at slightly higher risk for developing primary open-angle glaucoma. And people who are farsighted or hyperopic, they are at higher risk for developing a type of glaucoma called narrow angle or chronic angle closure glaucoma. And refractive error, or the need for glasses or contacts, is one of the most common problems that people have with their eyes. So refractive error can be associated with some different types of glaucoma. That's a good question.
Great, thanks so much. Dr. Reynolds, someone would like to know the kinds of challenges that you all have encountered when trying to build glaucoma awareness in the African American and Hispanic Latino communities.
That's a great question. Thank you so much. So some of the challenges that we face in building awareness about glaucoma is getting the information out there to most of the African American community. Again, men disproportionately are impacted a little bit, but yet when we have our community service events, we tend to see a lot more women participate in those events. So getting the information about glaucoma awareness to men has been a challenge, and I think November is Men's Health Awareness Month, so we're going to push to do something during that month to really get the word out about glaucoma in that population. Other challenges as well for our community engagement about glaucoma is a lot of the communities we serve is pretty diverse, and some of the patients are of Creole Haitian descent, and get them understanding glaucoma, which impacts their community, has been a challenge. And the NOA is currently working on revising our three-filing killer into Creole so that we can help spread awareness about glaucoma in that community as well.
Okay, yes, thank you, Dr. Reynolds. I was going to say thank you for sharing what some of those challenges are and also letting us know some of the strategies that the National Optometric Association is employing to address those challenges. Dr. Rosedal, we've got a participant who would like to know more information on the hereditary component of glaucoma.
That is a really good question. So we know that there is definitely a genetic component to glaucoma. It's much more common, in people who have a family history. The types of glaucoma that I mentioned affecting babies and children and younger people are often genetic. In older folks, we know that their genetics are involved, but it's quite complex. It's, very likely a mix of genes as well as environmental factors that you've accrued throughout your life, since the most common types of glaucoma are in older people, where it's not just one gene, but a mix of genes that are likely playing a role. Both the genes involved in the production and drainage of fluid there at the front of the eye, as well as genes that are involved in the kind of sensitivity of the optic nerve to the pressure. So I think that that's an area of active research where they find more genes, more, polymorphisms, more slight variants that, are associated or protective. So it's really quite an active area of research, but it's really quite murky in terms of what it can offer us in terms of, providing counseling to patients. In folks that have glaucoma at a younger age, those folks, we would call them juvenile open-angle glaucoma if they're diagnosed before age 40. glaucoma in children or teens, there it's much more likely to be a genetic contribution. And so there are some labs that are offering genetic testing for some of the more common genes involved. I don't offer routinely genetic testing to my kind of regular older patients, but when I have a patient who's younger than 30 or so, then you really want to think about whether genetic testing might be helpful to them.
Thank you, Dr. Rosal. And kind of an extension of that question, I believe, is someone was asking for a little bit more information on glaucoma in adolescents.
Yeah, so, glaucoma is very rare when you're younger, and I don't fall into this category, unfortunately, anymore, but younger than 40, it's really uncommon. Babies can be born with glaucoma, can develop it at a young age, and children at a young age. Adolescents, it's even less common. Kids that developed it when they were younger, obviously would still have it as adolescents. Adolescents might get secondary forms of glaucoma, for example, from trauma, like I mentioned, sometimes tumors that affect the eye, inflammatory conditions that affect the eye. Those are conditions that can cause secondary glaucomas in adolescents, but it's actually pretty rare to have glaucoma in that age group.
Thank you so much. Kim, we've got a question for you. One of our participants would like to know, does NEHAP have resources for Glaucoma Awareness Month to help with community outreach?
Yes, and thank you for asking. We've developed a whole suite of materials in both English and Spanish that can be used in January during Glaucoma Awareness Month. They can be used for community outreach, and we've done things such as articles for newsletters and print PSAs. We've also found that Glaucoma Awareness Month is a great time to use the glaucoma toolkits in English and Spanish, so we encourage you to make use of them.
Fantastic, and we hear folks at health fairs and doing outreach at senior centers, a lot of opportunities to use those free resources. Dr. Reynolds, we have a multi-question for you, pulling together a couple of our questions. Participants would like to know what should they do if they would like to invite the National Optometric Association to a local event, and in conjunction with that, how do I work with other groups to get on-site screenings?
Thank you so much, Ms. Shelley. And those are good questions. So the first one, to partner with us, the National Optometric Association, I would encourage you to go to our website, and there's a link there for you to contact the office, and our administrative director will get in touch with you. We recently partnered with NEHAP in doing a community event with one of our NOA doctors. So if you do that, we could definitely partner with you and get our NOA doctors to participate in your community event. The other part of that, I wanted to touch on what Kim was saying for Glaucoma Awareness Month really quickly before I go into the second question, and that is the social media platform is really another great way to promote glaucoma awareness. And NEHAP does a great job with their social media information about glaucoma. So for your organizations, during that month, you can push glaucoma information to the individuals in your organizations or to patients that you're seeing about glaucoma, encourage them to get their family members tested for glaucoma. So I just wanted to add that part to what Kim was saying, because we do that at the NOA every focus month. So January is Glaucoma Awareness Month, and we do that with their Diabetes Toolkit as well in November for Diabetes Awareness Month. And really quickly, Shelley, what was that second question? I apologize. What was the second part of the question?
No worries, and I'm actually going to add a third part to that, if that's all right. So it was about working with other groups to get on-site screening, and this might be a piece of it for you. What other agencies should be invited to health fairs? You talked about reaching out to the community and supporting health fairs, so how do they get on-site screenings, and what other groups should be invited to health fairs?
Okay, thank you. So for on-site screening, I would encourage, if you're close to a school or college of optometry, as a faculty member at Nova Southeastern University College of Optometry here in South Florida, we constantly participate in community outreach events and health fairs. So I would say contact maybe a school or college near where you are or your organization is, and also to major health institution. For us down here, Bascom Palmer, Jackson Memorial Health System has a mobile eye clinic that can participate in your community outreach events. So I would encourage you to reach out to those health agencies. The American Optometric Association, the AOA, our partner, their website also have information on community outreach that you can go on and get more information and who to partner with. And then working with other agencies, I think that's really important. We always reach out to other groups. For example, in South Florida, the local ADA, the American Diabetes Association, we reach out to them and partner with them when we do our diabetes awareness. And in glaucoma, we partner with other eye clinics, minority eye clinics, or those agencies that service Hispanic communities, our African American communities, and even our Creole communities, and work with them. I would also say encourage maybe the churches, other health group, maybe if you have the local National Dental Association or American Dental Association, to partner with them in doing your community service events. So just reach out to them. Information is available on their website, I'm pretty sure. And they're more than ready to get back in touch with you and partner with you in making sure that this health fair is effective. So I would encourage that you do that. Thank you. Shelley?
That was a lot of great information. Thank you so much, Dr. Reynolds. Dr. Rosedal, a couple of questions around misconceptions or myths about glaucoma. Can you share some that you've heard over the years from your patients?
Well, I'm going to come back to that high eye pressure one. Just last week, I had someone who came to see me for a second opinion because she didn't believe that she had glaucoma because her eye pressure, was normal. And she said, "Gosh, I just can't believe that I have glaucoma because my eye pressure has always been normal." But she had optic nerve changes, visual field defects, and really no other cause for those. And she had, the normal pressure type of glaucoma. So I think that's, really one of the most common misconceptions about glaucoma is that, high eye pressure is required. Some of the other misconceptions about it is that it equals blindness. A lot of people are really sad when they learn that they have glaucoma, early glaucoma, but I try to share with them how hopeful I am about that for them, because a diagnosis of early glaucoma where we're going to start treatment before they have any effects on their vision, and we're very likely to control it and have them never lose any vision, that's really very hopeful. And so a diagnosis of glaucoma doesn't mean that they're going to go blind. So I think that that's another misconception, is about, for sure that they're going to go blind, when that's really not the case. Most people who are treated for glaucoma don't go blind.
Thank you for that information and sharing myth-busting information. This question could go for both Dr. Rosedal and Dr. Reynolds. So I ask Dr. Reynolds if you'll answer it first, and then we'll go to Dr. Rosedal. If you're an eye care provider or health professional and you have a limited amount of time, but you want to do something in the community as it relates to increasing awareness about glaucoma, what might some of those activities be?
So the first one would be a partner with the local churches. I would definitely make time, maybe if the health events are too long or the health fairs are too long, limited time to go to the local churches, and maybe when they have health events, just to speak about glaucoma. I partnered with our local Lions Club in educating their members. We had a community event, and we just gave a quick presentation on glaucoma. We didn't provide the community health fair, but we provided valuable information about glaucoma for them. Schools, I think it's important at schools. I work with a local high school, and the young kids, we talk about health diseases. And so for me, it's important to also talk about glaucoma, and hopefully they could talk to their parents about the disease and maybe get the awareness about the condition that way. So those are some of the quick ways to do it if you don't have time. I think the most important is when we have our patients in our chair. I do encourage them, if they are diagnosed with glaucoma, to talk to their family members. As we said, family risk is an important factor. So if I tell my patients they have glaucoma, I encourage them to bring their family members in for a comprehensive dilated eye exam, because it can run in families. And usually that works. So usually I'll see the aunt or the brother or the cousin or the parents of that patient because they were concerned about glaucoma and the concern of the disease in their family members. So that's another quick way to really get the message out. And last but not least, the best way for me to increase awareness about glaucoma is information about glaucoma. One of the challenges in the urban community who are more at risk for this disease is maybe access to social media to answer their questions about glaucoma. So a lot of times it is incumbent on the doctor to explain the disease, and I've had many patients come back who tell me, and pardon this, but this is how they describe it, I have the coma instead of glaucoma because they don't understand their disease. So it's important for us to really talk to them about the disease, but also to provide health information, brochures, and literature so that they'll have that so if they have questions after they leave the office, they can read up about their disease. And that can help if they give it to their friends and family to know about the disease as well. So those are some quick pointers to really increase awareness about this condition.
Great, thank you. Anything to add to that, Dr. Rosendahl?
Yeah, those are some great ideas from Dr. Reynolds. What I would add is, hopefully everyone on the webinar is already connected with NEHEP, but I think, sharing on your own social media some of these NEHEP resources is a really powerful way to kind of help get the message out without very much work on your part, sharing these really short, punchy, fun things to kind of remind people to get their eyes checked. I think connecting with things that you're already doing. So, for example, I'm also a Girl Scout leader, and so for one of the activities we did this year was we had a little vision symposium where I taught the girls about eye health, and so that was a way to cross-pollinate some of the different things that you do. So I think if people have other things in their lives outside of their jobs, how can you bring glaucoma awareness or eye health awareness to those other venues? Can add a lot of value on both sides because it's really surprising how much people don't know about eye health and about eye disease, and just the ability to share that and make a big difference.
Great. Thank you so much. A lot of good information, and we appreciate all the questions that are coming in. We will do our very best to respond to you if we aren't able to answer your question because we've got time for one more question. Please either contact NEI, and you can ask your question there, or we'll be able to respond to you for a little bit in the chat box. So our final question is for Kim, and we've got some participants who want to know if you could share again the list of other program areas for NEHEP.
Certainly. In addition to glaucoma, which we've talked about today, we have program areas for diabetic eye disease, and we know every patient with diabetes is at increased risk for eye complications. We also have a program area for low vision. For those patients who cannot have their visual impairment corrected, we want to make sure that they are having the highest quality of life possible, and so we have resources to help them. We also, again, have the Ojo con su Visión program where we target specifically Hispanics and Latino communities, and a new program which is just getting ready to launch, the Right Division Make Your Plan to Protect Your Sight program, which will be specifically targeting African Americans and increasing their awareness.
Fantastic. Thank you all for your active engagement and participation. At this time, I'm going to turn the slides back over to Kim, and we'll finish with some information we want to share with you about how you can connect with NEHEP.
Thank you, and thank you for coming back to me. I did leave off one program, the Vision and Aging program. We also have targeting those populations, 60 and over, so sorry about that. Okay, this is going to conclude our webinar. I thank everybody. We ask you to please check our NEHEP resources on glaucoma and other eye diseases that you can use in your communities. We also invite you to subscribe to the NEHEP's Outlook newsletter. It offers quarterly updates. You can also connect with NEHEP on Facebook, Twitter, and other social media channels. So we look forward to having many of you join us. I also invite you to contact NEI or our guest speakers with any additional questions that you might have. Thank you, Dr. Rosendahl, Dr. Reynolds, and Shelley, and thanks to everyone for attending today's webinar.